individual was infected, and we don't know how, within the isolation unit, then it is possible that other individuals could have been infected as well.
There is growing concern that a 26-year-old nurse who became sick while caring for the Dallas Ebola patient may not be the only infected medical worker. Good evening, I'm Clarice Tinsley. The Centers for Disease Control is warning that more Ebola cases are possible among the staff at Texas Health Presbyterian. The CDC ordered a review of procedures for treating infected patients at Presbyterian and all other United States hospitals. The infected nurse was identified by a close family friend as 26-year-old Nina Pham. She was part of the care team for the first Ebola patient, Thomas Eric Duncan, and the hospital said she had extensive contact with him. There's been no update on her condition since she was placed in isolation Friday night, only that she is stable. Today, her apartment is the focus of an extensive cleaning operation that includes questions about what will happen to her dog. More on that cleanup and the dog coming up in a moment, but we begin with CDC investigation and Fox 4's Sean Rabb.
Good evening to you, Clarice, and here's what's happening. The Centers for Disease Control now really focusing in on healthcare workers here at Texas Health Presbyterian who tried to save Thomas Eric Duncan. Because one has gotten sick, the fear is now more could get sick.
We wish this individual had not been infected, and we're concerned that there could be other infections in the coming days.
She is called Patient 1, 26-year-old Nina Pham, seen here in pictures posted on social media, including with her dog. Pham, the nurse who provided care to Thomas Duncan, now fights against the Ebola virus that took his life.
She was there trying to help the first patient survive.
Health officials want to identify all hospital workers who tended to Duncan before his death October 8th.
And ensure that they are actively monitored for development of symptoms or fever. And if they develop either symptoms or fever, that they're immediately isolated, assessed, and tested.
A daunting task. More than 50 people were on the team fighting to save Duncan.
And the thinking here is straightforward. If this one individual was infected, and we don't know how, within the isolation unit, then it is possible that other individuals could have been infected as well. So we consider them to potentially be at risk.
This new Ebola case means more CDC workers from Atlanta and Dallas, because it now creates 3 categories of contacts that must be traced, all linked to Thomas Duncan, nurse Nina Pham, or through others.
Contacts with the index patient before he was hospitalized, contacts with the healthcare worker who was diagnosed yesterday, and contacts who may have also had contact with the index patient after he was hospitalized.
The ominous warning of possibly more Ebola patients in Dallas repeated over and over.
We need to consider the possibility that there could be additional cases, particularly among the healthcare workers who cared for the index patient when he was so ill. And so right now, the Centers for Disease Control tell us they don't know how large that concentric circle of contacts is going to look, kind of like that first circle with Thomas Duncan. They don't know how large that's going to be until they can interview all 50 plus of those healthcare workers and determine what kind of care they provided and when during Thomas Duncan's sickness did they provide that care. They hope to give us those numbers, Clarice, tomorrow.
Okay, Sean, was there one individual that Nina Pham had contact with that the CDC is especially concerned about right now?
Yes, and that's a close contact, a very close personal friend, perhaps intimate contact, not that she had intimacy with them, but a close contact, and that person, they believe, had contact with her when she was feverish, although a very low-grade fever. So that person has also been isolated, and they're being observed and monitored right now as well.
And Sean, was Nina, because she was a healthcare worker, was she part of the original group of 48, or was she in a completely different category?
No, she was in a separate category. Here's what we understand about that. The original 48, and we didn't learn this until really over the weekend, Clarice, that did not include any of the Presbyterian healthcare workers who cared for him after his arrival here. We think there were some 18, 19 plus who had this real contact with him. Again, a big team, but maybe 18, 19, 20 who had real contact with him. And then after Thomas Duncan died, those folk, we believe, were still here at work.
last week, and that's where the concern is now with the CDC, because Nina Pham has not been able to tell CDC researchers where the quote-unquote breach was, how she got infected, and because she doesn't know, because they think she took every step, there's concern that certainly other healthcare workers in that environment, when he was so sick, could possibly be at risk.
All right, and now they're watching at least 50 other people who are on that medical team. Sean Rabline.
I think we're going to see a very big number tomorrow
Yeah,
of
all right.
potential people in the pool.
Sean, thank you for the coverage from Texas Health Presbyterian.